Some people think the best health care is always somewhere else, a bigger city, another state. But Thomson Reuters, the leading source for healthcare data, just evaluated 321 health systems across the country for everything from quality and safety to efficiency and patient satisfaction. And guess what? One of the top 15 health systems in America, and the only one in Alabama, is right in your own backyard. Baptist Health really is leading the way.
They say into each life, some rain must fall. But if you or someone you care about is experiencing significant emotional problems, ranging from prolonged sadness or anger to fear or confusion, turn to Crossbridge Behavioral Health. Crossbridge, a Baptist health facility, offers innovative inpatient and outpatient treatment for adults and geriatrics in a modern, caring environment. Crossbridge and Baptist Health. Healthy mind, healthy body.
It's JT. We're here at Baptist South in Montgomery. We're talking with Dr. Suggs. Dr. Suggs, thanks for joining us.
Glad to be here.
And we've talked before about how Thomson Reuters has recently ranked Baptist South one of the top 15 health systems across the nation, which is great. And let's talk about the Stroke Center here at Baptist South. Tell our viewers what you guys have to offer when it comes to treatment.
Well, we've been working for the past year to develop our Stroke Center. And basically, when folks have a stroke, they need to be checked quickly. And everything has been gauged here to allow for a quick assessment for the stroke patient. In other words, there are certain things that have to happen before we can assess and make the decision to give our medicine for TPA. And there's a certification process that has been gone through by Baptist South to ensure that that happens. The Joint Commission is an organization that certifies hospitals, first of all, generally. So if you're certified or accredited, then the Joint Commission has done that. But they also have a disease-specific program for stroke. And they've come in now and did a one-day assessment of our ability to care for stroke. So if you come in the emergency room here, everything is geared toward a quick outcome, trying to get the CT scan as quickly as possible, which gives us information we need to make that decision for TPA. And it's a rigorous process, and there's a lot of different parts of the hospital that are involved. We had administrative personnel involved, we had laboratory, we had nursing, we had ER physicians, we had hospitalists, and laboratory and pharmacy, and just a whole host of different areas that are involved in this. And this is actually the first certified stroke center in the central part of Alabama. And there's only, I think, maybe 5 or 6 in the entire state that are certified. So we're real proud of that accomplishment.
What about stroke risk factors and prevention? JT spoke with Sharon Ewer, a stroke coordinator with Baptist. This information could truly be life-saving.
So when we're talking to our community about stroke prevention, we always assess whether it's a modifiable versus a non-modifiable risk factor. So things that they cannot change that put them at risk of having a stroke: their age. Anybody 55 years or older is at a high risk of having a stroke. Family history of stroke puts them at a risk of having a stroke. Their age, race, gender, a previous stroke or a previous MI also puts them at a high risk of having a stroke. So what we really want to focus on are things that we can change or modify, such as high blood pressure. If they have a history of high blood pressure, we want to make sure that they're taking their medications. We look at their social history. Are they a cigarette smoker? Do they abuse drugs? Do they abuse alcohol? All of those put them at risk of having a stroke as well. Other things that we look at, their cholesterol. Do they have a history of high cholesterol? Are they increased body weight? Physical activity? Their eating habits, poor eating habits as well, all contribute to those risk factors. Then we look at things such as sickle cell patients are at high risk. People with obstructive sleep apnea are also at high risk of stroke. When we look at their risk factors, we also look at, teaching them prevention and signs and symptoms to recognize if they're having a stroke or not. So we tell them to look at their face. Is their face uneven when they smile? Is their arm weak? Do they have numbness or tingling on one side of their body? And it's a sudden onset. So if they have a history of diabetes or something that puts them at risk of having neuropathy, that symptom that they'll have where they have tingling or weakness in one arm, we always tell them, this is different. This is a sudden onset. Headache, blurred vision, difficulty with their speech, understanding what they're saying or having difficulty understanding what someone else is saying to them. If they're having any of these symptoms, we always tell them just pick up the phone and call 911 immediately.
Thanks, Sharon, for sharing that great information. Learn more about stroke prevention and analyze your own risk factors by visiting the Primary Stroke Center under the Specialties and Services tab at baptistfirst.org.
We're speaking with Russell Tyner, who's the CEO of Baptist Health, and recently Thomson Reuters ranked Baptist Health one of the top 15 health systems in the country and the only one in the state of Alabama that was recognized. First of all, congratulations. That's awesome.
Thank you, JT.
Tell me a little bit about the plans and procedures that Baptist Health put into place several years ago to make that possible.
Well, what you see here at the Simulation Center is one of those things. 4 or 5 years ago, we began dabbling in the simulation arena. It's something that we learned from our friends in the aviation industry, particularly those in the Air Force in and around Montgomery. The simulation picked up very quickly in healthcare, and we were sort of on the cutting edge of that out front, but we learned very quickly also that simulation in and of itself was useful, but you had to put that curriculum in place too. So we laid on top of that something we call SMART training. That's a combination of aviation safety techniques and clinical safety techniques. That SMART training we were able to, with our partners at Auburn University, brand and actually have Raytheon utilizing now nationwide.
Wow, absolutely incredible, the technology. I mean, you just walk in the room and you can see that you guys are cutting edge, and that's sort of what it takes to qualify to be one of the top 15 health systems in the country. I mean, tell me a little bit about how that process works and how Baptist Health was recognized.
Well, the technology is incredibly important. I think one of those things for Baptist Health and for Montgomery and the River region in general has been that we've been able to attract and retain some of the brightest in the healthcare industry. You know, it's an uncommon collection of very intelligent, very capable professionals. Montgomery is one of those destinations where if you can get people here to take a look and make this their home, they usually will want to stay. And we've been very, very fortunate to keep not only a number of medical professionals who are from this area here after their training, but also to attract some people from all over the country. You have to have a wonderful team, but you also have to have the technology as well. Neither is going to work well in and of itself.
Absolutely. Well, congratulations once again.
Thank you very much.
Thank you for taking a moment to talk to us. And we're going to turn things over to Leanne, who's going to get an in-depth look at exactly what happens right here with Baptist Health.
Well, here we are in the simulation lab with Carla, and it is amazing the things that they can do in here and teach. So tell our viewers who you do teach, because that's what this is all about, is teaching and learning.
Okay. We teach a variety of healthcare professionals. We actually begin with school. We have juniors that come to us from Jeff Davis High School for the Healthcare Career Academy. We also have nursing students from 9 area schools of nursing that come here for training. We teach EMTs, the paramedics. We teach pharmacists, medical students, medical residents, medical doctors, and just a variety of healthcare learners that come through the center here.
Now, when JT and I toured earlier, there's so many different things and so many of these folks right here, and they can do anything. These simulation people, just they breathe, they can have heart attacks. I mean, there's just nothing that you can't program.
That's right. These are called human patient simulators, and it is really great to use these. This way our healthcare professionals actually learn in a safe and ethical environment where if something goes wrong with the mannequin, that they can practice over and over again how to really work with that patient and actually practice till it's perfect as you can get. So our big mission here is to reduce medical error, and that's one of the things that has been really valuable about that. We've actually trained over 3,000 of our healthcare professionals here at the Simulation Center, and we do a lot of training with medical resource team training, which you heard Russ speak about earlier, the SMART training, where we bring healthcare professionals from different areas into the center and do not only clinical training, but communication training.
Well, this has been eye-opening and amazing. For more information, you can check out riverregion.tv, and if you'd like to get trained, the information is there.